Before I get started, if you or someone you know is in crisis and needs access to resources, this QR code is going to be up the entire time. Scan that QR code for a list of resources and people you can contact. So, what is bullying and what can we do? Bullying is defined as the unwanted, intentional, and repeated aggressive behavior among school-aged children that involves a real or perceived power imbalance. Now, here are some important numbers. There are about 19% of students ages 12 to 18 have reported being bullied. About 26% in middle school and about 15% in high school. About 21% female and 16% male. There are 3 different types of bullying. The first one is verbal bullying. It's where you're saying or writing something mean about someone else. It can be teasing, name-calling, taunting, threatening to cause harm. It could also be inappropriate sexual comments. The second type is social bullying. It's sometimes referred to as relational bullying, and it involves hurting someone's reputation or relationships. This one can include leaving someone out on purpose, telling other children not to be friends with someone, spreading rumors about someone, and embarrassing someone in public. The last type of bullying is physical bullying. It involves hurting someone's body or their possessions. This one could be hitting, kicking, pinching, spitting, tripping or pushing, taking or breaking someone's things, and making mean or rude hand gestures. A group that is highly impacted by bullying are children and youth with special needs. It's important to remember that children and students that have neurological impairments may not understand that social interactions are actual bullying. They may need help understanding that that's what is happening. But how do we help them? How do we keep this from happening? Incorporating fostering a peer relationship with others. It's a team approach, and it's helping other students develop empathy, creating a buddy system for children with special needs, having a peer who is a traditional learner who they may see in a general education class, and also implementing some social emotional learning activities so they're able to see when those social instances are happening. How does bullying get to the point of suicide or self-harm? Although kids who are bullied are at risk of suicide, bullying alone is not the cause. Many issues contribute to suicide risk, including depression, problems at home, and trauma history. The risk can be increased further when these kids are not supported by parents, peers, and schools. Bullying can make an unsupported situation worse. Let's talk about some warning signs and things to be on the lookout for and listen for. The student may show some symptoms of depression. They can be a changing in their personality and eating and sleeping habits. They may withdraw from family and friends. They may be talking about or making threats of suicide. They just might outright say it. They may be planning it. Sometimes they might make arrangements to say goodbyes or give away some of their favorite things. If they do start talking about suicide or making threats of suicide, make sure you do not leave them alone and get professional help immediately. How can we prevent those feelings of helplessness and hopelessness from escalating to self-harm or suicide? It's restricting access to anything that could be considered lethal means in your home. That even includes over-the-counter medication, definitely firearms or other weapons, just anything that could be used for that. You may hear about these escalations from bullying to self-harm or suicide and think, oh, but that's not happening where I live. The CDC recently did a study, and it showed that 39.7% of students experience persistent feelings of sadness and hopelessness, 28.5% experience poor mental health, and 20.4% seriously considered attempting suicide, and 9.5% had attempted suicide. Suicide is the second leading cause of death in the United States among young people ages 12 to 18, and lesbian, gay, bisexual, transgender, and questioning youth are 4 times more likely to consider suicide than their peers. I have compiled a list of some resources. Please reach out to these if you need them.